Let's bring in Dr. Vin Gupta, MS Now senior medical analyst. It's good to have you back, Dr. Gupta, although too soon. We were last week talking about hantavirus. What is your concern level about Ebola?
Well, Sarah, good morning. I would say that to echo the president's comments, this is a concerning virus. Just like hantavirus, it's different. It has a high fatality rate. It is contagious in close quarters, and clearly we're seeing that we're detecting this outbreak in the Congo a bit later in its course. Already 130 people dead, 600 cases. It seems like it's going to get worse before it gets better. So there's a level of seriousness that I think we should credit the president and his CDC for acknowledging. So on the pros of what we're seeing here, the CDC has communicated clearly to the public that this is serious, but that it is still low risk to the American public in terms of transmission and community spread. I think that is correct. They have deployed long-standing relationships in the Democratic Republic of Congo, in Uganda, to make sure that they have whatever surveillance infrastructure is in place for testing and treatment, that those are activated. And so long-standing relationships here matter. And frankly, Sarah, you want outbreak containment to be boring and methodical. And so they're trying to leverage those relationships as great as possible.
So what is the likelihood that they can successfully do that and make sure it does not spread beyond Africa?
Well, today's announcement on airport screening, to me, makes sense. You want symptomatic screening from places. You want to route passengers, Americans that are coming from affected countries, to airports here that have the capabilities to do symptom monitoring and testing. So, again, these steps make sense. The concern here that has been levied repeatedly, both for hantavirus and now for Ebola, is despite some of these positive steps from the CDC, they're going to be hamstrung by longer-term considerations for preparedness and response, whether it's Ebola or whether it's the next virus. And so, we're talking about what happened to USAID, PEPFAR. These are key global health programs that have had bipartisan support. Sarah, continue to have bipartisan support to some degree, especially PEPFAR. And what do? I don't think we talk a lot about this to the American public. These actually put in place an early warning system for detection of infectious diseases across the world. Americans are safer if we're detecting these diseases earlier and intervening earlier. That's to the net benefit of all of us, and those have been hampered significantly. Obviously, we're not a part of the WHO anymore, so communication, command and control, broader coordination has taken a hit. So these longer-term issues with preparedness and response, I think we have to acknowledge, is not in the best interest of our national security, even despite some positive moves by the CDC in the short term.
Yeah, certainly when those budgets were being debated, there were warnings about that something like this could happen. There was some reporting around what's happening on the ground. Congolese authorities arguing that, for example, testing is just extremely hampered. I think they can only do a handful of tests per hour. Is that a direct consequence of some of these budgets getting demolished?
Yeah, Carl, I'll say I was 13 years U.S. Air Force Reserves, and we did a lot in the way of capacity building in places like Uganda and other countries in sub-Saharan Africa. And what I'll say is the U.S. military historically has played a really important role in emergency preparedness and building hospital capacity, especially in the setting of health emergencies. Also to build testing, also for logistics, just moving supply and materiel. That's not happening nearly to the same degree as it previously did during other outbreaks, say the 2014 to 2016 West Africa Ebola epidemic. That was largely U.S. military assistance guiding what was happening there on the ground. And so exactly to your point, Carl, yes, of course, diagnostic testing we're hearing is limited, especially for this strain that is less common. There are no vaccines or treatments. Diagnostic testing, of course, is limited. So we're probably underestimating the number of cases and the number of and the degree of spread. So I suspect you're going to see more cases, unfortunately more deaths. But again, U.S. military involvement, just to be clear for our viewers here, has been central in curtailing these outbreaks in the past. We're not seeing that same response now.